welcome back. Today's topic is D. So with it being winter, I thought we'd do D for depression. Probably more specifically perinatal depression. So most people have heard of postnatal depression, but assessing depression in pregnancy is actually quite tricky because a lot of the symptoms look just like pregnancy symptoms. So how do you know if you've actually got depression? I think sometimes the answer to that is you probably don't. It might be more that it's someone around you who's noticing that you're just not yourself, and it's more than just kind of pregnancy aches and pains and niggles and not loving every minute of it, which is quite normal, but it's something more than that. So how do you know if it's something more than that? Usually as a psychologist, I will look at things like your sleeping, your eating, your mood, and a little bit about how you're socializing, how's your communication going. But how do you separate this? It's hard. So let's kind of look at what we're talking about. With eating, in depression we look at, are you eating too little or are you eating too much? But when you're pregnant, it's quite normal to be feeling like you're eating too much, or to have days where you're feeling like you just don't want to eat at all, or if you've been vomiting, you've got morning sickness and you're just off food. But with depression, it doesn't leave you. It's there most of the day, every day, for weeks on end. So that's something to kind of think about. Similar with sleep, when you're pregnant, it's normal to have periods of insomnia. It's normal to have days where you could sleep for hours on end and no amount of sleep makes you feel better. But again, it generally shifts when it's just regular pregnancy symptoms. With depression, it doesn't leave you. It might be that you can't sleep no matter what you do, or that you're just sleeping through anything. And it wouldn't matter what sort of day you were having. If there was something really amazing, some amazing event on, you would still just rather sleep. You couldn't get yourself out of bed, and you can't get yourself to just get on with things. That might be a sign that you're feeling depressed. Similar with your mood, it's normal in pregnancy to have, crazy mood swings, to feel anxious, to feel stressed, to feel like, every time someone asks you, are you excited about the pregnancy? And you're not excited, because you can't be excited 24/7. That's something I always tell people. It's, other people are excited for you, but they're just in the moment of finding out that you're pregnant, or they're just thinking about you at the moment. They're not living with it 24/7. So it's normal not to love every single minute of your pregnancy. But if you're finding that you're pretending, sometimes I ask people this, are you really putting all of your effort into acting as if everything's fine, everything's totally normal, when on the inside you are drowning? You're not enjoying this pregnancy. You're not enjoying life. Nothing is getting you excited about life. Nothing's funny anymore. Sometimes that's a bit of a giveaway. If no joke is funny, no movie's funny, nothing that you used to find amusing or entertaining is doing it for you anymore, and you're just pretending. You're just laughing along when people tell a joke or people tell an anecdote, and you really don't care because you feel miserable. That might be more likely that you're depressed. In terms of socializing, it's different for everybody. Don't feel, if you're feeling a bit like you just want to withdraw, that's normal for pregnancy. But if it's the case where you don't want to even talk to people that you like, you don't want to talk to people that you love, your partner, it might be, can't convince you to do something nice for yourself. They maybe offer, do you want to go out and see a movie? Do you want to go and get a massage? And you would just rather sit at home because you can't be bothered, because it's too much effort, because it's too hard. That's more likely that you're depressed. So what can you do about it? I say take, people's ideas into consideration. Someone is not, if they know you well, not someone who's just saying something off the cuff because they don't know what they're talking about, but someone who loves you and somebody who knows you well. If they are suggesting that maybe you're not quite yourself and maybe, you're looking like you're depressed, it's tempting to want to bite their head off and say, I'm pregnant, I'm miserable, leave me alone. But maybe just take it under consideration and think about some of these points about, all right, is this a bit more than just I'm unhappy in my pregnancy, but I'm just really unhappy in general? What can you do? Things that you can do. You can talk to somebody. There's always somebody out there. There's a really good service called Panda, who I will link below, who deals specifically with pregnancy, depression, anxiety, all through the perinatal period. They are great, so they're great people to get in contact with. You might want to start by just downloading an app and doing a bit of mindfulness. So there's an app called Mind the Bump, which is a really good app for just, giving you some tune out time to connect with your baby, connect with your body, just try and let it all wash over you so you're not feeling quite so stressed. So I'll link that down below as well. And also just, being kind to yourself. Again, remembering that, as I said, you don't have to love every single minute of every single day of this pregnancy. It's all right if you're not excited all the time. But if it's getting too much and it's getting to be like just not fun at all, then talk to somebody. You can always contact me. You can find me at drerin.com.au and my details will be linked below as well. And I think, this is something to be mindful of. As I said, depression in pregnancy is actually really hard to diagnose, but it doesn't hurt to just do some check-ins. And I'll link some things you might want to think about below as well, just to kind of do it's not like a formal assessment or anything like that, but it's just some things to think about to know the difference between, am I just in a bit of a pregnancy funk, or is this something more than that? Because it's common, it's just not, as I said, the postnatal depression period is relatively well covered now with postnatal depression, but perinatal depression is trickier to identify. So it's good to just check in and be mindful of what's happening for you at the moment.